Is what the saying?
안녕하세요. 홀리스틱 바디의 지민입니다. 여러분, 오늘은 마스터리가 환자를 치료하는 영상을 보여드리려고 하는데요. 마스터리는 국내에선 유일하게 간스테드.com에 등록되어 있는 간스테드 닥터입니다. 간스테드 카이로프랙틱은 신경이 압박되는 부분을 찾아서 그걸 서블럭세이션이라고도 하는데요. 교정해주고 몸의 자가치유 능력을 돕는 학문입니다. 어떤 식으로 치료가 진행되는지 영상을 통해서 자세히 보시고요. 영상을 보시고 많은 관심과 또 궁금한 점 댓글로 남겨주세요.
Any special symptom or any pain right now, or just you might have some discomfort?
Actually, as a student, I've been studying a lot since ever before, and I can say I have a weaker backbone and also weak stomach.
Your stomach.
Yeah, my digestion system seems not that strong due to, I think it's due to too much work, I guess. Yeah, too much work. Yeah, it's not that severe, but there are many discomfort, especially the last 10 or about 9-10 months. I don't feel comfortable with my backbone.
Yeah, I can see. You are sitting like
The way I see it, right? Yeah.
If you sit like that, I can see you. It's difficult,
Yes, you're right.
You have to.
I don't feel comfortable. Yeah.
And you any specific kind of discomfort?
Yes.
Right in here?
Right. Just a moment. Yeah, right here I feel the pain.
A little bit lower. Your a little bit lower.
And also recently, I feel pain here. Yeah.
Okay. Any stiffness?
Yes, stiffness and feel discomfort here. Yeah. Especially moving my neck.
You're moving
Yes,
your
yeah.
neck.
I feel pain.
And in which direction you might feel more difficult? To turn left or to right?
Turn left is difficult.
Could you do that for me?
Yeah.
Can you? Which side do you feel more stiffness or
Here.
pain?
Here.
Right there.
Yeah.
How about the other side?
Same thing.
So what do you do for if you have some time? You do walking or
Mostly I enjoy reading, so
reading
I would say average 10 hours I sit
every day?
whenever I study.
You study.
Yeah.
So you're sitting
Yeah.
and you don't move, just sit there.
I don't move, just focus on the computer or the books that I'm reading. Yeah.
Do you have any questions?
Some of my friends in the church told me about the chiropractic, and as a Christian, I believe in healing and the help of God and prayer. But at the same time, it's our responsibility to take care of our body and get all the necessary treatments and those kind of assistance from professional people like you. So that's why I came hoping I will get some assistance from the professionally trained people like you. So,
but specifically, I'm a Gonstead chiropractor.
yeah, I guess.
So Gonstead is Dr. Gonstead is his name, and he developed and researched his own method to find, we call it subluxation. And subluxation means there is something is interfering the bone, bone misaligned, and then that causes the pressing on the nerve. And then the nerve is coming out of your spine, and it goes all the way your organ system, your digestive system, like your lungs or heart, anything like on your parts. So when you have something, you feel any symptoms, you might have a migraine, or you might have some numbness on your legs, or some stomach problem. So what we want to do is we try to find the subluxation. that is our job. Finding, and this we call the nerve skull. And what it does is, it's kind of, I go all the way. I'm gonna scanning your spine, and it detects some of your temperature, your body temperature. But it's not like just this body temperature, but what's going on in your body inside. If there is a nerve is pinching, it shows something. Called the break.
Oh, the break.
That's good. Okay, let's do from the upper thoracic and going all the way down. Okay, so I'm gonna just see a little bit. Okay, so you have some right in there. Okay. Do you have any headache recently? And when you have some stomach trouble, do you feel any headache at the same time, or?
I think I would call it a weekend headache. I often have on Saturdays. Because the time, my schedule is a bit different than the weekdays, so
it's the different time schedule between
so
the
that
weekdays.
causes me headache.
So it's usually Saturday.
Usually Saturday. Yeah.
I'm trying to feel something. We call it edema, like a little. You know the rotten apple feeling.
Yeah, I see.
Feel any soreness around here? You okay?
It's a bit painful, I think. Up there, yeah.
Right there. How about the above one?
That's fine.
That's fine. But this one
over there, yes.
You can feel a little
yes.
wet feeling.
Yeah. That's it.
Okay, so head down, please. Count your spine. So this is your C7, the vertebral prominence. And it's T1, 2, 3, 4, 5, 6. So gonna check your. We call a little bump here. This is your pelvis.
Okay.
We call PSIS. Stands for posterior superior iliac spine. Okay. Can you just stand up? Okay. Just from there, I'm just checking your height. See. Okay. Can you just bring your knee, left knee? Bring it up. Bring it up. Okay, down. Okay. Okay. Okay, down. On the right side. Okay. Do it again. Okay. And if you feel difference when you're standing leg?
No.
Which one is more?
Fine, but I think when I lift, the feeling here is different.
Well, on the right side.
Yeah.
When
I lift this one up, the feeling here is different than this one.
Okay. Yeah. This is your right, we call sacroiliac joint. Your pelvis. Two joints are meets. Any feel tenderness around here?
Yes.
Bottom one?
There, over there.
Over here?
Yes.
How about the left side?
That's okay.
It's okay.
Yeah.
So you have down here some pain point, and I guess your right ilium, we call it right ilium, has gone more like anterior and superior, like this way. So this is a little higher, maybe more higher side than the left side. And this is your L5, the last lumbar vertebra, and this is your S1. And this is your S2 sacrum. Feel any tender?
Yeah.
Very much. How about the second? Both. Is it about the same?
The upper one is
Upper
a bit
one is more.
Oh, yeah.
Okay. How about the bottom one?
That's better.
That's better.
Yeah.
So write it this one.
Yeah.
Okay. This is your S1. First the sacrum.
That's so painful.
Okay. Put your arms right here. I'm gonna just turn your body.
Okay.
Feel your left sacral iliac joint. It should be separate and smooth motion. Upper. Okay. The upper one is fine, but over. Okay. Okay. So I found that you got something is going on your
The right side.
right side,
Mhm.
and I'm just gonna explain to you very quickly.
All right.
So this is your the pelvis.
Mhm.
This is left side, and this is your hip joint.
All right.
Your legs.
Yeah.
Right.
Yeah.
And the right side,
Yeah.
what I found was your this is gone a little higher, like this way, and so you at the bottom of your SI joint, I can feel some of the pain tenderness, and then also this is your sacrum.
Yeah.
First, second, third, fourth. There's usually 5 vertebrae, 5 sacrums, and then the bottom is the coccyx, and these are fused. But in our Gonstead Chiropractic, Dr. Gonstead found out that these 5 vertebrae, each one has a separate segment. They are fused, but they have a separate the movement, motion. So the S1 is very tender. So I guess you might have a little posterior. Suppose this one has gone like this way, and then might have a little rotation. But we don't have the X-ray on your body. But I'm guessing you have this problem because you have too much slouching this way. And this bone has been too much pushing. See, I'm checking your feet, the bottom of your feet. You got a little squeeze, narrow your more on your left side.
I see.
You're supposed your pinky should be here, but because of your shoes, right? A little the positive heel shoes. Any casual or any sneakers, everything has a little the heels, right?
Yeah.
And at the bottom, the front side, we call it the toe box. Toe box is very narrow, so your foot are squeezed, and that affects yours. The foot does affect your ankle, knee, and hip and spine.
I see.
So I'm gonna loosen up your feet first. Okay. Ready?
Yeah.
All right. Have you done any sports activity while you were in school? Playing something soccer?
Playing soccer, running. We do that often. Yeah.
Are you okay, Pastor?
He's in pain.
A little bit, but it's bearable.
You're very good at
Enduring.
High tolerance.
tolerance, high tolerance. Okay, just let go. Okay, let me just breathe again. Just checking how it feels your legs. How is it?
Yeah. this part is.
Yeah. So this, can you see you can go a little higher than before?
I think so. Yeah.
Yeah, you think so, right?
Mhm.
Because you close your eyes and you don't see.
I can feel it.
You can feel it, yeah.
Yeah.
Wow. See that your ankles
Yeah.
twisted. Do you know what these sounds come from?
What is that?
This is your Achilles tendon.
Mhm.
Tendon attached to your bone.
Mm-hmm.
And because you're wearing shoes,
Yeah.
you're walking like this,
Mm-hmm.
duck,
Mm-hmm.
right?
Mm.
It's most of your weight
Rested because
put
of the
on
heel,
the
right?
side,
Yeah.
and you're twisted.
Mm.
So when I'm trying to kind of pull your ankle and try to straighten up,
Okay.
your tendons can go pop up, and that's
Go back to
Yeah.
its original place.
yeah, it kind of off the track,
Mm.
and then that the sounds comes from. Yes. Okay.
That's a loud one.
Yeah.
Okay, and see. Just gonna check your sacrum. You can lay down your left shoulder down.
Again, same position.
Same position.
Yeah.
And this time I'll set the first sacrum.
Okay.
This is good. It's kind of a little pop.
Mm-hmm.
Pop
Yeah,
up
you told
and
me.
try to
that.
push back.
Mhm.
And that way, the pressure around here. Most people they have a problem around here. This is L5,
Mm.
the sacrum.
Mm.
We call lumbosacral junction.
Okay.
If this sacrum, this area, sitting too many hours for many years,
Yeah.
it causes nerve pressure, disc pressure. And so you go to the hospital and take an X-ray.
Mhm.
Most people they have the discs.
Mhm.
They are very squeezed, narrow. So they got injection or something like doing minor surgery, not surgery, but doing lots of treatment.
Mhm.
But because of the problem is not here, but it's going more down here. You're gonna fix this problem sacrum.
Yeah.
They'll loosen up many tensions, many the pressures on your L5.
Got it.
Lay down. Get straight bottom leg. You have this position before.
Yeah. Just right before.
This is your 새우가.
Yeah. When
Shrimp cracker.
How about the second boy? He's
he is
months?
15 months.
15 months.
Yeah.
Turn your chin back a little bit.
Mhm.
Neutral position your spine.
And look forward. Push forward.
Good. Your shoulders. Yeah. Good. So I'm going stretching your
Mhm.
shoulders. Okay. You're not gonna fall down. CPSIS, L5. Have you ever broken your bone or
No,
not that you remember?
I don't remember. Over there is too painful. Oh.
First is sacrum, and so a little stretch. Slowly. Yeah. Good. That's good enough. Okay, relax. You can take a deep breath in. And down. Okay, stretch. Good. Okay. Okay. What?
It's a big release.
What happened? Something.
Okay. We can try the
Yeah, that's
right
right.
shoulder down. I'll check the same area.
Okay.
Oh my.
I might pick up a little more depth. Yeah.
More depth. That was deep enough. I felt.
it was.
Yeah. Well, I like to check it again. Anyway,
Okay.
Yeah. Like
This.
belly forward a little more. Yeah. You okay?
Yes.
Yeah. Just belly forward. Just push a little bit. Not shoulder.
Okay, just the belly.
Yeah. So this is Gonstead side posture. We call it side posture. It's not like the kind of twisting, cracking your bone, but
Yeah.
as I explained to you, I want just specifically contact your S1, so
Yeah.
first the sacrum, and then
Mm.
you want to just put it back to their normal position, just this one.
Mm.
But like many people, they are kind of too much twisting.
Yeah.
It feels good, but it's a
It
little
needs to get the
different.
right position anyway, right?
Yeah.
Mm.
So, okay. I might do a little to the rotation component.
Mm-hmm.
The P, we call the P-R, and the first the sacrum.
Mm-hmm.
That kind of go close down your open wedge. First the sacrum. Okay, stretch. Good. Okay. See that?
Yeah.
Yeah. All right. Okay, stand up. Found it was a T7.
Mm.
1, 2, 3, 4, 5, 6, 7. 2, 6, 7. T7. You okay here? A little. Is it tender?
Mm.
How about the above one? First and second. Right this way. Okay. T7, P down, PS. Belly down. Okay. Relax your shoulder down. Good. Gotta put a little pressure. Okay here? Okay. Yeah. Good. But you are pointed at somewhere
Yeah.
around here.
Yes, right there.
Like this one?
Yes.
Like the bottom one. First or second?
That one.
That one.
Yeah.
Okay. Is it bother you whatever you do, sitting or standing?
Yes, so that part. Almost 10 months, I think.
10 months, yeah. 1, 7, 11, check it out. 1, 2, 3, 6, 7, 8, 9, 10. It's 11. 5, 4, 3, 2, 1, 12, 11. It's 11, your thoracic vertebrae. See. Okay, take a breath in. So all the way out. Relax your belly. Okay.
Yeah.
A little pressure on it. Oh. So painful. Okay, that's good enough for today. How's it?
I'm fine. Yeah.
You're fine?
Feeling good. Yes.
This is your C7.
Mm-hmm.
Yeah, I feel much definitely you feel more range of motion.
Yeah.
But still,
Yeah, the pain is there.
mm,
But movement is more.
mhm.
That's all.
C7. Your C7.
All the way back.
For me? Good. So what I'll do is I'll contact your C7, cervical vertebrae, and it's from here. So it feels like this, I going a little this way, and then I'll do like this. This. Is it okay for you?
Yeah.
Okay. Let's drop your shoulder down a little bit. Good. Chin down a little bit.
Everything is cracking.
How do you feel?
Yeah, no pain.
No pain? Oh, wonderful. Wow. Became a new human being. New life.
That's amazing.
Yeah,
Pain is
I'll
not there.
just loosen up your muscle on your right upper trap area.
How do you feel? You feel good?
Yeah, the pain.
Went away?
Yeah, I don't feel it anymore.
So we, as a Gonstead chiropractor, we try to fixing the we call subluxation, which is the nerve interference.
Yeah.
But sometimes you too much stuff in going on in
The muscle there.
your muscles.
Mhm.
So we need some little loosen up your muscle.
Yeah.
That also helps your nerve system, your muscle, nerve, skeleton. They're all they're connected each other. They're affecting each other. Right there. Yeah. 곰 한 마리. You know that? 곰 is
곰.
sitting right there.
Yeah. Come on, Mary.
Gotta do a little from here. You can go forward. And chest up and just look right there. From here, the neck and your scapula. There's a muscle called rhomboid. It starts from your C6, C7 and goes to your scapula.
Yeah.
날개뼈. Scapula. Shoulder blade. So it's very important muscle. It affects your neck, it affects your shoulder and your this way going down. Feel stretching some of the This muscle starts from the upper part of your neck
Mm-hmm.
and it goes down like this. This is your 고만마리 sitting right there. So it's gonna break down the spot,
Mm-hmm.
the hard spot right there.
Break the gum.
Break the gum. Yeah.
Break the gum.
Yep. Ah, it's so painful.
So you can have a little start from here and all the way down.
That bear doesn't want to be broken.
Mm-hmm.
And more. All right, right there. Okay. Yeah, that's
Wow.
another 고만마리.
Yeah, breaking is not easy.
Yeah.
Comb is bare, right?
Yes.
Mm-hmm.
And push it down. Doing like this massage or spreading toes,
Yeah.
you give a little help to the people. I
Mm-hmm.
think that's the very good way you spread the gospel.
Yeah, that's true. I agree. Yeah.
The people there, they love the touching and
I think it's good to give this kind of treatment for many people who are working.
right. And it's gonna take some time, to breaking down, but
Yeah.
it's good start. Yeah, it's very good start.
Mm.
Wow.
Mhm.
And the more left side, I feel a little more steeper on the
Mhm.
left side.
Mm-hmm. Then the right side. Yeah.
And you just turn around to the left. See that?
Oh,
You
wow.
get it all the way down.
It's like 360 now.
Yeah.
Oh, wow.
That's amazing.
Going down. Good. Backward. Yeah. How about the feel down here?
I feel much better.
Much better?
Everywhere. Yeah.
How about checking your sacrum? Just checking your motion.
Mm-hmm.
How about it down here? Any tenderness?
I don't feel it like.
Wow, you had a pain.
Not a pain here.
Yeah. Very.
Okay, that's good. And see, check your S1. Going all the way up like this, sitting backward. Feel any pain or
A little bit.
a little bit?
Yeah, not like before.
Yeah.
Yeah.
Okay. All set.
Wow. That's
All
amazing.
right.
Even driving, I had to trouble turning. Like this.
Right.
It's really amazing.
That causes many car
Car accident.
accidents.
Yeah. It does.
Because of the bear. You got that
Because
bear
of the
gone.
bear on my shoulder.
So how?
I feel much better. Yeah, my neck is good. So, you see,
Yeah.
I couldn't.
That's
even
amazing.
do this.
And fingers,
Yeah.
toes grab together.
Wow.
Okay.
Tired.
So like you don't have to exactly,
Yeah.
but just try to feel the lengthening your spine, bigger breathe, wide length, and that affects your spine all the way down.
Yeah.
Okay. So every half an hour, you stand up and
Do that
breathing,
for a few minutes.
grab. Feel your foot, your toes, your foot, grab, spread.
Good.
감사합니다.
Thank you so much. Thank you. Thank you, Dr. Lee.
Yeah.
I really appreciate it. Yeah. It feels so good.